My name is Ronald Stram. I'm the director and founder of the Stram Center for Integrative Medicine. We're excited to be entering into our 20th year of practice. This has been a dream since I was a child, to develop a team of providers that are enthusiastic, curious about new ways of practicing medicine, and also looking at what has been practiced, ancient wisdom in medicine, looking at traditional Chinese medicine ideas, food choices that are old but now can be reborn into a new practice of integrative medicine. I believe also that in medicine one always has to be curious, always has to look at what are the causal relationships for why people feel ill. And investigation is really a big part of this practice. So not only do we feel that we do high touch, but also high tech. So whether it's looking at microbiome DNA results and looking at the gut, or looking at new forms of testing for tick-borne illness, or treatment that is really cutting edge where we're using maybe postbiotic, fecal transplant-like material, to hyperbaric, to new types of infusions for nutritional infusions. But our goal is to get at the root cause of the disease and to treat that disease. And that is through these testings, through these intravenous therapies, hyperbaric oxygen, which is just an exciting adjunct to this practice. We feel that those modalities in themselves have really created a really great space for people to heal in. Being a doctor, being a provider, you have to love your patients. You have to love what you do. You have to love the curious nature of trying to figure out the missing piece in the puzzle. And seeing people get better, knowing people that you can give them hope, that you have something to offer them, not just maybe a drug, but really your care. And I'm excited for the next 20 years of our practice.
Hi, I'm Corey Doroma. I'm a naturopathic doctor with the Stram Center for Integrative Medicine, and I am also currently the medical director of our Vermont practice. What brought me into naturopathic medicine was a background in my family, my father having been a physician assistant, and seeing what conventional medicine was, and then hearing about naturopathic medicine, and really the blending of natural therapies just really made sense to me. One of the most unique therapies that we offer at the Stram Center, both in New York and in Vermont, is high-pressure hyperbaric oxygen therapy, which allows oxygen to get into cells, which helps to heal cells, decrease inflammation, and help to heal such disorders such as chronic inflammation, traumatic brain injuries, cognitive issues, and overall helps to increase energy. As part of a naturopathic intake, when I see patients, I really try to get to know somebody. We try to spend as much time as we can with our patients. Really try to find the root cause of their symptoms, what's potentially causing their illness, and we really try to utilize our therapies and natural therapies to help stimulate the self-healing process. I've been here since 2007, and really it's because I thoroughly enjoy working here. I enjoy being able to help our patients in this capacity, in this collaborative effort with Dr. Stram and our other providers.
Hi, my name is Dr. Heather Hasland. I'm a family nurse practitioner with a doctorate in nursing practice, and I also act as the assistant medical director here at the Stram Center in the Del Mar office. Previously, I worked in mainstream medicine through the urgent care setting, family medicine, and prior to becoming a family nurse practitioner, I worked as a nurse in ICU and labor and delivery. In mainstream medicine, I loved doing procedures, I loved caring for the acute patient, but I've always wanted to work more with the whole person, preventative medicine, and alternative therapies. I've been at the Stram Center since 2021, and since joining the team, I've never looked back. I thoroughly enjoy working here with this team. It's very cohesive. We work very collaboratively together, and the kinds of patients that we see all ages, and We really like to dig deeper with these patients. A lot of our patients come to us after seeing multiple providers, multiple specialists. We've had new and exciting therapies start here at the Stram Center, including PRP for scar reduction, hair growth for the scalp. We also use it microneedling up the face as far as wrinkles, anti-aging properties. We also offer sclerotherapy, which is a new treatment that we're doing, and this is reduction in spider veins in the legs. So not only we want patients to feel their best, but we also want to heal them. So since being here at the Stram Center, I really have started to really love medicine again, being able to take the time with patients and care for patients in the ways that are breaking down barriers in healthcare. And just seeing how well patients do with the treatments is very inspiring. And I can't wait to see where things progress to go and keep learning over the next years.
Hi, my name is Caitlin Serber, and I'm a physician associate at the Stram Center. Well, from a young age, I was exposed to the medical field. My brother had chronic illness, and that sparked my interest in medicine and furthermore in chronic disease management. At the Stram Center, we address a wide range of women's health concerns, from women looking for prevention and wellness to women's health in the setting of chronic complex illness. And we often treat women's health conditions including irregular menstrual cycles, premenstrual syndrome, painful periods, menopause, infertility, sexual health, endometriosis, and polycystic ovarian syndrome, and even cancer. Today, I performed an injection on Dr. Stram, which is one of the many different options of regenerative joint injections that we offer here at the Stram Center. They work so well that our own staff and office uses them, and we trust them. And Dr. Stram's had a couple of injections that he's noted significant improvement in his knee pain and in the inflammation in his joints. And he's a very active person, and he's continuing to improve his knee stability with these injections. So as a team, we're a very collaborative team, and part of that collaboration is having the trust in one another. I feel privileged being able to work at the Stram Center and collaborate with our strong team that we have here.
My name is Dr. Catherine Bolter. I run the Vermont office of the Stram Center. I'm a naturopathic doctor, which means that my specialty is looking for the underlying causes of disease and illness and treating the whole person. What drew me to naturopathic medicine is that it sets itself apart from conventional medicine in its philosophy. We believe that the body has an inherent ability to heal. If you remove the underlying causes of disease, then your body will find its way back to health. We really are doing specialty testing and in-depth interviews to find out what the underlying cause is. We're not interested in putting Band-Aids on your symptoms. We really want to find out what is the best diet, what is the best lifestyle, what are the things that are holding you back from feeling your best. My specialty is focused on tick-borne disease and environmental illness. Things like mold toxicity, air pollution, water pollution, exposure to toxins in the workplace, exposure to toxins in our home. Those things all add up over time and make us feel unwell, and there are things that we can do about it. Our tools in naturopathic medicine are really great at helping the body detoxify and reestablish after being exposed to these toxins over time. I like working at the Stram Center because it's a team of like-minded healthcare professionals that are always thinking about the patient's well-being first and thinking about what are the best treatments out there that we can offer.
I'm Jana. I'm the dietitian here at the Stram Center, and I've been here since 2019. So my role here at the Stram Center is multifaceted. I work with every patient who's seeing a main provider to make sure that they are progressing towards their goals. In the realm of nutrition, there's so much information out there, and it can be really overwhelming and confusing. So I work to turn that around and promote healing through food. Food can either contribute to pain and inflammation, or it can be a source of healing. And so I really work with each patient to find a food plan that is really realistic for their lifestyle and helps them progress towards their healing. I think my favorite part of what I do is that I get to know people. And I really love working with people one-on-one, understanding what's going to work best for them in their lifestyle. Are they someone who cooks? Or is cooking not going to work for them? How can we work a healthy nutrition plan into their busy lifestyle? If someone is open to making some healthy changes, then that's only going to benefit their total recovery. So some of the testing that we offer, of course, is stool testing, and it really gives us a wealth of information. It will show us if a patient is digesting their food properly or not able to break it down. It will show us sometimes if they have a gluten sensitivity or if their gut is inflamed. And that can enable us to recommend specific supplements and dietary interventions to heal their gut. Gut health is so important because majority of our immune system is derived from the gut. Also, our gut produces most of our serotonin and our dopamine, our feel-good neurotransmitters. So, our overall wellness, our ability to heal, and our mental health is dependent on our gut health. I love every person that works here, and not many people can say that about their job and their colleagues, but it's a real honor to be able to provide this care to my patients and work with this team.
I'm Danielle, and I'm a psychotherapist. As a therapist, I like to help my clients gain a better understanding of each part of themselves and to learn what these parts of them need and to allow love in. Working with my clients, I also like to focus on the body and what our body is telling us. I believe as a therapist that the most important part of therapy is the relationship that you have with the client, and that relationship can help correct other relationships in your life, and it can help bridge new ones that are more healthy. At the Stram Center, we have many chronically ill patients, and I find that mental health support can really help that client grieve their former life and help find new meaning and make adjustments to their new one. And also just provide a space for that client to just talk and vent and work through all those feelings that come with being chronically ill. It's a privilege for me to be able to engage in these meaningful relationships with my clients, and I have seen progress in almost all of my clients who I've been working with, and it's an honor for me to be there with them and watch them grow. When working with a therapist, I find that it's very important to grieve what used to help you. So to grieve those coping skills. So if you used to love to run and now you can't, you can grieve that. But now maybe you can walk or do exercises that are less impactful on the body. Working with me, I will help my clients find coping strategies that fit with the version of themselves now, not the version of themselves prior to them being sick. I love my job, and I am honored to be here every single day.
I'm Shannon Gorman. I am the Nursing and Infusion Manager at the Stram Center. My background is cardiac critical care. I did that for several years and then stumbled upon this place, kind of on accident, but it was a beautiful accident. And I just really love working here. We do so many great things for our patients. We see a variety of people, a lot of people that have been kind of let down by the healthcare system, and we're trying to change that. And it's a really beautiful process to have such a collaborative practice with all of the different providers that we have. So in the infusion suite, we see quite a few different patients. We see cancer patients that are getting supportive IV therapy with artemisian and vitamin C. We get a lot of wellness patients, people that just want to come in and get a little vitamin boost when they're not feeling so great. And then we have our chronically ill Lyme patients that come in for long-term antibiotics. And it's a really great mix, and it's really great seeing all of the patients come together and finally find a space where they can heal and they can listen and have someone listen to them. One of the beautiful things about this practice is how accessible the providers are and how appreciated they all make you feel. I've never worked in a place that's felt so much like family. So our practice isn't a revolving door. It's not all about getting the patients in and out. It's about actually spending time with them and letting them be heard. No other place have I ever seen a provider spend an hour and a half with one patient and getting such a detailed history. And it's something that's really great. In addition to that, they get all of this supportive care on top of it. I just love working here because everyone here is so appreciative of everything you do. Nothing's taken for granted, and they show you that you're appreciated rather than as just another cog in the wheel. It's a really great place to work.
I'm Rebecca Rice. I'm a licensed acupuncturist and I'm a doctor of acupuncture and Chinese medicine. I've been at the Stram Center for 20 years since its inception. I've always been a driven person with a passion for nature, science, and creativity. So studying Chinese medicine was the perfect next step for me in my education. Chinese medicine consists of several modalities. So acupuncture is the most popular one. We also have herbal medicine, nutrition, diet therapy, Tui Na, which is also acupressure or massage, Qigong, which includes meditation and gentle exercises, and things like cupping and moxibustion and heat therapy. With these natural therapies, we're looking to treat the patient's condition in a very gentle, effective way, and each session is tailored to a specific person based on their constitution and diagnosis in Chinese medicine. As an acupuncturist, I see pain, so musculoskeletal pain issues, women's health and fertility issues, allergy and autoimmune issues, and digestive conditions, also mental health issues. Women come in wanting to conceive, and acupuncture helps them conceive. I've seen people who have been in chronic pain for months, years, and acupuncture and Chinese medicine relieves them of that pain and they can get back to their life. Being able to help people with their wellness goals or their health issues that have been holding them back for a really long time is truly rewarding.
I'm Liza Pollack. I have a master's degree in acupuncture and oriental medicine, and I have been a licensed acupuncturist since 2009 and have been with the Stram Center since 2017. It's always been my dream to work at an integrative center to be able to offer a more well-rounded approach. Chinese medicine is a unique system of healthcare that assesses a person's health from a different framework. So you're getting input from a different perspective. Pain is what brings most people to acupuncture, and we do treat any kind of pain. But Chinese medicine addresses anything health and medically related. So things like digestive disorders, respiratory, cardiovascular, urinary, skin, all kinds of women's health issues, as well as things like anxiety and depression and addictions. An acupuncturist is kind of like a general practitioner, but here at the Stram Center, I do see a lot of tick-borne illnesses and cancer. I've been on a cancer journey myself since 2015 and have also dealt with Lyme and co-infections for longer than that. And the Stram Center has been my lifeline. Conventional cancer treatment is very difficult to go through on every level, and acupuncture and Chinese herbs can help improve quality of life during and after. And there's modern research supporting this. And this is when it can be helpful to see an acupuncturist as well as any of our other providers here to help you heal and prevent a recurrence and get you back to feeling more like yourself again. I love working here and I love my coworkers, and that makes a difference for people seeking care here.
My name is Lisa Field, and I'm a massage therapist at the Stram Center of Integrative Medicine with advanced skills in myofascial and craniosacral techniques. I started working here in 2015. Actually, I was a patient here first. I loved the treatment that I received, and I just loved the vibe in the building. So one day I handed in my papers and said, if you ever get an opening, please call me. And they called me the next day. I think it was just meant to be. At the Stram Center and with my work, we're looking for the root causes of issues. It's a holistic approach that looks at the overall health of an individual and not just at the symptoms. We all bring a different skill set to the table, and then we collaborate and share our information for the health and well-being of our patients. Massage therapy incorporates my previous medical knowledge with my passion for learning and my compassion for people. I specialize in a technique called myofascial release. Myo is the prefix for dealing with muscle, and fascia is connective tissue, which we all have head to foot throughout our bodies. My work differs from a traditional massage in a few ways. First of all, I don't use any lotions or oils on the skin because I need to feel into the tissues without sliding. Then I use gentle, sustained holds to feel into the restrictions of the connective tissue and release those restrictions. It is these releases that affect change, that reduce pain, increase range of motion, stimulate blood and lymph flow, help with postural changes, and more. It's lovely work that anyone can benefit from.
Good. All right, well then I will see you next time.